I need to kind of ask you a geopolitical question because it seems to me like this is a very fragile time in global affairs. It seems to me after watching the G7 in Canada, I sort of saw this in Hamburg in the G20, that the United States seems to be walking away from its enthusiasm for global stuff on all fronts. And there's a trust problem out there that seems to be building. I just met with leaders across Europe, and they will privately say they no longer trust the United States for their dark days, whatever those dark days may be. And these are our closest allies in the world. And so I'm interested in whether that affects your world or not. And I go back just on May 9th this year, George W. Bush did a wonderful job kind of memorializing, looking back and commemorating PEPFAR, the 20th anniversary of PEPFAR. And it was an incredibly, tribute, bipartisan discussion about what had been, it made me reflect on today. So if you were to grade us today, the Trump administration, even the Obama administration in contrast with the Bush administration and what it led on PEPFAR, what do you feel about where the world is tipping and how the current administration is approaching some of these issues? And remember, you no longer work for the government.
Yeah. First, PEPFAR is an amazing accomplishment. It is a game-changing, world-changing initiative. I have colleagues who worked in Malawi and elsewhere for decades and who described the advent of HIV, where it seemed like, talk about pessimism, all hope was lost. The only businesses flourishing were undertakers and coffin makers. To treatment coming in and suddenly a truly new hope and rebounding life expectancy, increased, improved health systems. So PEPFAR has been a huge success, which wouldn't have been possible without George W. Bush's leadership on it. I think that the next big thing in public health is global health security. And the baton has been passed from the Obama administration to the Trump administration, and they haven't yet dropped it. They haven't necessarily picked it up enthusiastically, but they've said good things about it. They've actually put $59 million more in CDC's proposed budget next year. That's not 100, but it's not zero either. So I think jury is still out. There's obviously a lot of changes at the White House, and there are different ways to run programs. Sometimes the locus of effective programs is in the agencies, and sometimes it's outside of the agencies. And, if I were CDC and seeing the White House kind of distracted on other things, I would move very rapidly forward in doing the things that they say they want to have done, because they've said very good things about commitment to global health security. But show me your budget, I'll show you your values. The real question here is, can we maintain the focus on this area that's a little hard to understand, a little hard to explain? And that's what our website is hoping to do a bit of, though it's really focused on low and middle income countries. But the issue is CEPI, for example, really exciting. $500 million.
We're not in it, right?
What's the U.S. doing? Nothing, really.
Well, they're collaborating with BARDA and others.
Yeah, we
Collaborating, $0 collaborating.
Well, our BARDA actually does the same thing. So we're now getting, CEPI's getting other governments and other partners to buy into the same kind of energy.
I sense that Ron's hair is on fire.
A little bit. So
But how do you really feel?
yeah, so look, I have a big career as a partisan, so I'm going to just lay that out there. It's a fact. But what I will say is I've tried very hard in this area to really take a nonpartisan approach to the issue of pandemic prevention. And as Tom mentioned, we had great bipartisan support on Capitol Hill for the Ebola response. I've certainly acclaimed what President Bush did in PEPFAR. And this should not be a political or partisan issue. It hasn't been. Viruses don't ask your party affiliation before they infect you. That said, there is real reason to be scared of the idea of us facing this threat with Donald Trump in the White House. And there are three specific reasons why I make that provocative statement. The first is that the president is anti-science. He trades in attacking experts. He trades in conspiracy theories. All those things would lead to the loss of many lives in the event of an epidemic in the United States, where we would need the public not to trade in conspiracy theories, not to believe that the news was fake, but to respect scientific expertise. Secondly, he has an incredibly isolationist mindset, And that leads to the US pulling back from its leadership and its involvement in these global crises. And that is also going to be a serious threat to our security. And finally, he has policies and views that are xenophobic, if not racist, and those lead to blaming immigrants and foreigners for problems when we need public health interventions. And I will say that these statements aren't hypothetical. We saw what President Trump said as a citizen during the Ebola outbreak in 2014, where he tweeted false information, where he attacked medical experts, and where he said explicitly that doctors and nurses from America who are fighting Ebola in West Africa who got sick should be left there to die. And fortunately, President Obama did not listen to that, and I've met the brave men and women who we medevaced back here and who are alive and well as a result of that. More recently, during the Zika outbreak in 2015 and 2016, the kind of xenophobic attitudes that the president promoted was one of the reasons why Congress did not fund promptly the Zika response package. When I would advocate for that, what I heard time and again was, Zika isn't a public health problem, it's an immigration problem. Just keep those people from Latin America and South America out of the country, we won't have Zika. So we need leadership that is focused, that is pro-science, that doesn't traffic in conspiracies, that invests in these things, and that doesn't have these isolationist attitudes. And those attitudes put us all at risk.